Welcome to this video on initial assessment and management of trauma patients. This video will cover the key steps in the initial assessment and resuscitation of injured patients. The content is referenced from the Advanced Trauma Life Support, 10th edition. The main goal is to rapidly assess injuries and institute life-preserving therapy. A systematic approach is crucial, and the primary survey must be repeated frequently to identify deterioration. The objectives include understanding pre-hospital and hospital preparation, identifying assessment priorities, explaining the primary and secondary surveys, and recognizing patients who require transfer. The preparation phase involves pre-hospital coordination, focusing on airway, bleeding control, and immobilization. In the hospital, ensure the resuscitation area is ready with equipment, warmed fluids, and appropriate standard precautions. Triage involves sorting patients based on resources. For multiple casualties, treat those with life-threatening problems first. For mass casualties, treat those with the greatest chance of survival and least resource expenditure first, based on ABC. The primary survey uses the ABCDEs to prioritize life-threatening conditions. A quick 10-second assessment can give initial clues about the patient's airway and consciousness. For airway, inspect for obstructions and suction secretions. Always assume spinal injury and restrict cervical spine motion. Definitive airway management is often needed for a GCS of 8 or less. Breathing assessment includes lung function and chest wall integrity. Immediately treat tension pneumothorax with chest decompression and provide supplemental oxygen to all injured patients. Hemorrhage is the leading preventable death cause. Assess consciousness, skin perfusion, and central pulse. Control external bleeding with direct pressure and establish 2 large-bore IVs for warmed fluid administration. Disability involves determining the level of consciousness using the Glasgow Coma Scale and assessing pupil reaction. Changes in consciousness should be presumed due to CNS injury until proven otherwise. Exposure requires completely undressing the patient for evaluation. Crucially, prevent hypothermia using warm blankets, warmed fluids, and increasing room temperature. Adjuncts to the primary survey include ECG, pulse oximetry, and capnography. Be aware of contraindications for urinary and gastric catheters. X-rays and ultrasound, like FAST or EFAST, are also important tools. The secondary survey is a head-to-toe evaluation and complete history performed after the primary survey and stabilization. The ample mnemonic helps gather essential historical information. Special populations require adjusted assessment. For transfer, initiate the process promptly when higher care is needed. Do not delay transfer for in-depth diagnostic testing and maintain good communication.